So you cut like about a foot when you're flossing your tooth, and then you tie it from one end, tie it on the middle finger, tie it on the middle finger on the other one, leaving the other loose and free. When do you need to floss? The food that sticks in between the back teeth, the premolars and the molars. When that food stays there, especially small pieces of meat, it kind of starts slow rotting inside there. And it's actually the one that starts decay or cavities in between the teeth. Most people you'll find they don't have any cavities, but when you take an X-ray, you find a small dark shadow in between. That means they've not been flossing their teeth. And therefore, some decay starts in between the teeth and progresses right into their tooth. Sometimes they may have pain, but when you check, you can't see anything. But the tooth started rotting right from in between, and that's why we need to floss. With a dental floss, you can actually almost prevent tooth decay almost 100% for people who floss every day. And then the other thing is that sometimes if you don't floss for a week or so, if you take in your floss, that floss will be having a bad smell. That contributes to the issue of the bad breath. That's another reason we need to floss on a regular basis, on a daily basis, because not only does it prevent tooth decay, it also improves our breath, because there is that part that we did not be able to clean. All adults, even children, they should be able to floss. But for much younger children, I normally encourage the parents, once every few days, you can just go in and the child can lie on your lap, facing up, and you can go in and just go through. And that really helps even for the young kids with the baby teeth. So I think flossing is, it's actually part of your brushing protocol that we do every day, and we should do it.
It's as important as brushing.
It is exactly. It completes the brushing. Once you've just brushed with your toothbrush and you've not flossed, you've not completed the process.
Okay, I'm sure another question some might have, because right now in the market there are so many products.
Yes.
You see this one is string.
Yes.
There are those ones that are sticks.
Yes.
There are all these different variations.
Yes.
Which one would you recommend as an expert in this field?
The string is the most ideal because, as I said, you are using a clean part of the floss to clean between each tooth. Whereas the one which comes with like a stick, a small piece of floss, you are using it to floss the whole mouth. That means, as I said, you are probably just transmitting bacteria from one side to the other one. That one I normally say is useful for a quick one. Let's say you are in a function or something like that, where again, you cannot be flossing teeth in public. But that one you may cover your mouth a bit and just remove something, a big chunk of food or something with that. That can be done. But then the other thing is, when we come to sustainability and environment, you realize that many of these things have got this sharp plastic thing, and which doesn't burn, which doesn't degrade. So we are introducing so much plastic into the environment that is not good for the environment. It appears like it's a cool thing to do, but on the long run, it's a polluter of the environment. So I would still advocate for this string, which if you burn it, it will burn. Imagine everybody is just using those, how many millions of
the
plastics.
And they're just throwing them everywhere.
And they're, exactly, yes, because they don't even throw them in the dustbin. People will be throwing them on the streets, and it's sharp. It can traumatize people and that kind of thing. So I can say you can have it for a quick whatever in a function, but that's not what we should be using on a daily basis. This is one of the very common flosses by one of the companies. It comes in like that. So you cut like about a foot when you're flossing your tooth, and then you tie it from one end, tie it on the middle finger, tie it on the middle finger on the other one, leaving the other loose and free, and start at one point in the mouth, let's say at the back. And you just gently go in. Don't push it very strongly, because that way you'll end up hurting your gums, but just like thread a little like this. That's why we call it a floss. You're flossing. And then you clean in between the teeth. Then once you do that, tie the dirty part, the used part on the finger, go to a cleaner part. So for each tooth, you are using a clean part of the floss, because you don't want to transmit bacteria from one area of the mouth to another area, because there could be a little infection somewhere, but the other side doesn't have infection. So you want to use a clean part of the dental floss. We normally recommend minimum once a day.